In the quiet moments when a loved one with dementia slips away, the disease itself often creates an overwhelming silence, one that's filled with both sorrow and, strangely, peace. Have you ever wondered what exactly happens in the final stages of dementia? How does someone die from dementia? And more importantly, what does this process truly look like? If you're a caregiver, or if you're simply trying to understand the nature of this heartbreaking condition, you're in the right place. In this video, we're going to walk through the often misunderstood journey of dementia's progression. From the initial stages to the heartbreaking final moments, we'll explore the typical decline, what causes death, and how you, as a caregiver or family member, can help ease your loved one's journey with dignity. Stick with me till the end, as I'll also share some personal insights, stories, and ways to find comfort and clarity during this difficult time. What happens during dementia's final stages? Dementia is a term that encompasses a range of symptoms related to cognitive decline, including Alzheimer's disease, Parkinson's, and more. While each of these conditions presents itself differently, they share a common progression. Dementia is a cruel disease, not only because of its devastating effects on memory and behavior, but also because of its slow and relentless nature. At the start, the decline can be gradual. Family members often find themselves adjusting to new, unsettling changes, forgetfulness, confusion, and disorientation. But as time goes on, this progression leads to a series of critical stages, with the patient eventually entering the final phase of life. This video will focus on how that happens, what caregivers can expect, and how you can offer comfort during those difficult moments. The staircase decline. Dementia doesn't follow a sharp, clear-cut decline like some other illnesses. Instead, it's more like climbing stairs. Your loved one reaches a plateau where things seem to stabilize, only to suddenly take a downward turn. In my experience working in the hospice field, we often see dementia patients navigating this staircase progression. The tricky part? Just when you think things are improving, an unexpected event can trigger a sharp decline. Often, it's something like a fall or an infection, like a urinary tract infection, UTI, or aspiration pneumonia, which happens when food particles enter the lungs. At this point, the person's health may worsen quickly, creating a dramatic change in their condition. The good news is that this is often followed by another plateau, where things stabilize for a while before another inevitable decline. Personal insight. I recall one particularly tough case. A patient named Margaret had been stable for several months, and her family felt a sense of calm. But after a minor fall, she contracted a chest infection. Her family watched helplessly as her health deteriorated rapidly. This scenario isn't uncommon. UTIs and pneumonia are unfortunately frequent causes of severe decline for dementia patients. What actually causes death? A common question I hear from caregivers and families is, what do people with dementia actually die from? There are two main factors: the progression of the disease itself and complications that arise as a result of the illness. The most common cause of death in dementia patients is not from the disease directly, but from its complications. As dementia advances, it typically leads to a point where the person can no longer feed themselves or maintain hydration. The result? They stop eating and drinking, which causes a kind of natural death. While this may sound grim, it's often a peaceful end. In the final stages of dementia, the person often becomes unresponsive, sleeping most of the time, and may not be aware of their condition. The agitation and confusion that may have marked their earlier stages tend to vanish as they near the end. Many families find this part of the journey surprisingly calm and even serene. Personal insight. I remember Sarah, a patient whose family had been by her side through many years of gradual decline. When her final days came, it was almost as if she was ready to let go. Her family reported that in those last few days, Sarah didn't speak much, but she had moments of peacefulness, and the discomfort and confusion she'd once experienced seemed to fade. It reminded me that sometimes the end can bring a sense of relief to both the patient and their loved ones. Supporting your loved one during end-of-life care. As a caregiver, your role can feel both heartbreaking and empowering. There is so much you can do to provide comfort during the end stages of dementia. Your focus should always be on keeping the person clean, safe, and comfortable. These elements are crucial because the last stages can be physically draining for the person and emotionally exhausting for the family. Keep them clean. In the advanced stages, individuals may have difficulty maintaining personal hygiene. It's important to stay on top of this, as poor hygiene can lead to infections. Keep them safe. Fall prevention is crucial. Dementia patients are often disoriented, and falls are a significant risk. Keep them comfortable. This is an ongoing challenge, especially as mobility decreases. Make sure they are as comfortable as possible, often with small adjustments like extra pillows or blankets to avoid pressure sores. The challenges of skincare and pressure sores. As dementia patients often spend most of their time in bed, pressure sores or bed sores can develop. These occur when prolonged pressure on the skin cuts off circulation, leading to painful wounds. The best prevention is frequent repositioning. I recommend gently rotating the patient every couple of hours, using cushions to relieve pressure on sensitive areas like the heels and buttocks. A personal story that comes to mind. Jane, a long-term dementia patient, developed a pressure sore even though her caregivers took great care in repositioning her regularly. Unfortunately, skin breakdown is sometimes an unavoidable consequence of the disease. However, it didn't mean the caregivers weren't doing a great job. They just had to continue their efforts and consult medical professionals to prevent further damage. How you can help if you're supporting someone with dementia. It's easy to feel overwhelmed, but there are simple yet effective ways to be of service. First and foremost, offer your presence. Sometimes the greatest gift you can give to a caregiver is time. Offer to sit with the patient while the caregiver takes a break. Bring over coffee, meals, or just your company. And if you are the caregiver, don't be afraid to accept help. It's easy to feel like you should do everything yourself, but you need breaks too. A reminder to caregivers: it's okay to ask for help. No one should walk this path alone. Conclusion. In the end, dementia's toll is both physical and emotional. But there's beauty in providing care with compassion and patience. Watching someone you love pass through the stages of dementia is never easy. But by understanding the disease's progression and the peace that can come in its final moments, you can offer your loved one comfort. The journey is long, but in those last moments you might find that peace is what remains. So, be present, be patient, and give yourself the grace you deserve as you care for someone through this difficult time. And always remember, you're not alone in this journey. Closing remark. Thank you for watching this video. I hope it has shed some light on what to expect in the later stages of dementia, how to provide the best care, and how to find peace during this journey. If you found this helpful, don't forget to like and share. And if you have any personal stories or questions, feel free to comment below. I'd love to hear from you. Take care of yourself and take care of your loved ones. By maintaining sensitivity, compassion, and a deep understanding of the progression of dementia, we can all provide the best possible care for those we love in their final stages.